Hi, welcome again. This is Valerie. Today I'll be addressing mental health condition known as ADHD, which stands for Attention Deficit Hyperactive Disorder. I will look at the cause, the effect, diagnosis, and as well intervention. So um, let's talk about the causes. Um, One of many causes that has been talked about has to do with genetics because professionals or psychiatrists or medical professionals believe that ADHD tends to run in families, and it's a genetic factor, um, and it is one that is considered as a major cause. Another one is brain structure and function, and with this, they look at differences in brain activity, especially in areas that control attention and impulse control. And third, they looked at environmental factors, and this has to do with exposure to toxics like lead, smoking, or alcohol use during pregnancy and premature birth, which they also said may contribute to um, an environmental factor leading to ADHD. And another cause looked at was or studied was neurological imbalance, and this has to do with imbalance in neurotransmitters like dopamine, which affect attention and behavior. So some of the effects of ADHD has to do with various areas, including academic and work struggles. So some of the science has to do with trouble focusing, completing tasks, and staying organized, and that can affect performance. Another one has that has been looked at has to do with behavioral challenges, and some of the way this affects people living with ADHD um, can be seen in their behaviors, such as impulsivity and hyperactivity, which may lead to disciplinary issues and conflict with peers and authority figures. And another cause or effect has to do with low self esteem. So there's constant criticism of failure, which can damage self confidence, and especially in children. So, um, another effect is mental health um, comorbidities, which is higher risk of anxiety, depression, learning disorders, and substance abuse. So, with regards to diagnosis, there is clinical evaluation, and this is conducted by psychologists, psychiatrists, or pediatrician using behavioral assessment and interviews. Another tool for diagnosis is the diagnostic criteria, and in doing so, to be diagnosed with ADHD, it must meet symptoms listed rather in the DSM-5 for at least 6 months, with signs present before age 12. And also, there is the input from multiple sources, which indicates that diagnosis often involves feedback from parents, teachers, and sometimes standardized questionnaires. And last but not least, another form of diagnosis is to rule out other conditions, and it's important to distinguish ADHD from other issues like anxiety, learning disability, or trauma. Some of the interventions that are in place for ADHD includes medication, and some of these medications are stimulants, for example, Ritalin, um, Adderall, and non-stimulants, which help to regulate brain chemistry and improve focus. Another form of intervention is behavioral therapy, and this focuses on managing behavior, setting routines, and developing coping strategies. Third is educational support. It's another form of intervention, and that looks at individualized education plans, IEPs, classroom accommodations, and tutoring, which can help students thrive. There's also another form of intervention, which is parental training and support, and this equips parents with strategies to support their child and manage challenges at home. And lastly is lifestyle adjustments. Um, and this is another form of intervention, and this has to do with ensuring that the individual has regular sleep, physical activity, and healthy nutrition, which is there to improve focus and mood. I hope that this brief explanation on ADHD has been helpful and has somehow explained the cause um, and some of the effects and interventions. I hope that this has been helpful to you. And also, please go to your local clinic, find more information, and ask your doctor lots of questions. Ask doctors for referrals and find out how you can get support through your clinic, hospital, or healthcare facility. I hope this has been helpful. Thank you for stopping by. Thank you for listening, and have yourself a beautiful day. Bye for now.